Question number 1. Which of the following is a therapeutic communication technique? The right answer is option C. Tell me more about what's on your mind. Question number 2. A nurse is caring for a client with a chest tube which finding requires immediate intervention. The right answer is option C. Continuous bubbling in the water seal chamber. Question number 3. A patient with COPD is on 2L oxygen. What requires action? The right answer is option C. Respiratory rate of 8 breaths per minute. Question number 4. After surgery, a client reports chest pain and shortness of breath. What should the nurse do first? The right answer is option C. Check oxygen saturation. Question number 5. A patient with stroke has right-sided weakness. Which is the priority goal? The right answer is option A. Prevent skin breakdown. Question number 6. Which finding a postoperative client requires immediate attention? The right answer is option B. Urine output of 20 ml per hour. Question number 7. A nurse is caring for a patient on warfarin, which indicates effectiveness. The right answer is option A. INR of 3.0. Question number 8. Which instruction is most important for a patient taking lithium? The right answer is option C. Maintain consistent sodium intake. Question number 9. A patient is prescribed vancomycin IV. What is the nurse's priority? The right answer is option B. Check for red mane syndrome. Question number 10. A client taking prosimide show ECG changes. What lab should the nurse check first? The right answer is option C. Potassium. Question number 11. A client on heparin develops a platelet count of 80,000. What is the concern? The right answer is option A. Bleeding risk. Question number 12. What is the priority teaching for a patient on prednisone? The right answer is option B. Report signs of infection. Question number 13. Which side effect is most concerning in a patient taking amlodipine? The right answer is option C. Urinary retention. Question number 14. A patient is prescribed nitroglycerine. What indicates teaching was effective? The right answer is option B. I will take the tablet before exercising. Question number 15. A client at 38 weeks reports sudden vaginal bleeding and no pain. What should the nurse suspect? The right answer is option B. Placenta previa. Question number 16. A pregnant woman has a positive contractions test. What does this indicate? The right answer is option C. Uteroplacental insufficiency. Question number 17. A nurse notes lead deceleration on the fetal monitor. What is the first action? The right answer is option A. Turn the patient to the left side. Question number 18. A postpartum patient has saturated a perineal pad in 30 minutes. What should the nurse do first? The right answer is option A. Massage the fundus. Question number 19. A patient with schizophrenia says, I am king. What is this an example of? The right answer is option B. Illusion. Question number 20. A client is passing and shouting. What should the nurse do first? The right answer is option D. Offer to talk in a quiet room. Question number 21. Which findings suggest lithium toxicity? The right answer is option B. Diarrhea and tremors. Question number 22. A depressed patient says, I have no reason to live. What is the priority? The right answer is option B. Ask about suicide plan. Question number 23. A toddler ingested a bottle of iron tablets. What is the priority intervention? The right answer is option C. Call poison control. Question number 24. What is the most important teaching for a child with asthma? The right answer is option C. Monitor peak flow. Question number 25. A child with fever is prescribed aspirin. What is the concern? The right answer is option C. A syndrome. Question number 26. A child receiving IV fluids is irritable and has bulging fondlets. What does this indicate? The right answer is option C. Fluid overload. Question number 27. Which client should the nurse see first? The right answer is option C. CHF client with crackles. Question number 28. Which task can the RN delegate to the CNA? The right answer is option B. Take vital signs. Question number 29. Which patient should the nurse see first after shift report? The right answer is option A. Chest pain and dyspnea. Question number 30. Which task is appropriate to delegate to an LPN? The right answer is option C. Own dressing change. Question number 31. A nurse is assessing a client with cirrhosis. Which finding is most concerning? The right answer is option C. Astaxis. Question number 32. A client on total parental nutrition TPN suddenly develops depression and confusion. What is the nurse's priority action? The right answer is option B. Check blood glucose. Question number 33. Which task can be safely delegated to a licensed practical nurse LPN? The right answer is option C. Monitoring a stable patient's own dressing. Question number 34. A client receiving chemotherapy reports a mouth pain and difficulty eating. What should the nurse do first? The right answer is option C. Assess the oral cavity. Question number 35. A nurse is educating a patient starting on penutine. Which statement by the patient indicates understanding? The right answer is option B. I may have bleeding gums. Thanks for watching.